Tonight on KQED Newsroom, what happens when all of California's intensive care hospital beds are filled? And when will the state begin receiving vaccines? We ask two healthcare leaders these burning questions and more. And a new documentary opens our eyes to the world of working parents struggling to find childcare. We speak with the filmmaker and a childcare advocate about how the coronavirus pandemic has exposed a system they say is unsustainable. Plus, natural splendor and California history combine for this week's look at something beautiful. Welcome to KQED Newsroom. I'm Priya David Clemens. This week, President-elect Joe Biden echoed a coronavirus warning we've been hearing for months that we're in for a very dark winter. Today, we appear to be on that doorstep. America's case numbers are among the worst reported in the world. Over the past week, more than 200,000 new cases were reported every single day in the United States. Intensive care units around the state are on the verge of becoming overwhelmed with patients suffering from COVID-19. Despite months of social distancing, mask wearing, and now fresh lockdown restrictions affecting nearly all of California's 40 million residents. While the hope of a vaccine is closer to a reality every day, questions abound. How quickly can we make the vaccine? And how will hospitals cope until it's widely adopted? Joining us now from San Francisco is Dr. Robert Wachter, chair of the Department of Medicine at UC San Francisco. And joining us from Sacramento is Carmela Coyle, president and CEO of the California Hospital Association. They both join by Skype, and thank you very much for taking the time to speak with us. Carmela, I'm going to start with you. The California Hospital Association represents more than 400 California hospitals. How severe is the demand on California hospitals right now? I'd love a situation report.
The numbers that we're seeing right now are more than alarming. We have more than 30,000 Californians who are becoming COVID positive each and every day. That is 3 times more than anything we saw at the peak of our last surge in the summer. 12% of those individuals are in need of hospital care, and that means our hospitals are stretched to their limits. Right now, statewide, about 85% of our ICU beds are filled, but California is a big state. And what that means is in some places, San Diego, Imperial County, the Los Angeles area, San Joaquin County, we've got hospitals whose ICU capacity right now is filled to its limit.
And Bob, we spoke with you just before Thanksgiving here on KQED Newsroom, and you'd warned us of a post-Thanksgiving surge. Are we seeing the full effect of that surge in hospitals, and is it as bad as you'd expected?
The timing is such that the effects of Thanksgiving are now being seen in terms of hospital admissions. It's interesting because the shape of the curve, the trajectory, is not up that much more after Thanksgiving than it was before. I think the surge is mostly reflected in the fact that we're not seeing a decrease in cases. In other words, the prior surges that we saw in California and that they've seen elsewhere usually last about 6 weeks, and then people hear the messages from our health officials and from our political leaders, and they see what's going on around them, and they change their behavior, and then things start coming down. We're not seeing any signs of admissions coming down, ICU admissions coming down, or new cases coming down. So I think the surge is mostly that we're not seeing things come down, which is scary for the Christmas holidays because it may mean that this surge goes on until mid-January.
And Carmela, many hospitals haven't canceled elective procedures yet. It would seem to indicate the pandemic isn't so dire that we're running out of beds for patients. Is that a fair assessment of the situation?
That would be a misunderstanding of the situation. That is, it's going to be really important for us to provide care not just to patients with COVID-19, but to everyone else who has essential needs as well. Heart attack patients, stroke patients, cancer patients. And so what every hospital is doing literally on a daily basis is monitoring what their capacity is in the ICU and then shifting, balancing that with the patient needs that they have in their community. So we want to make certain we can care for Californians equitably. I think the other piece to that question is what we're really short on are those all-important critical care nurses, those nurses who work in the ICUs. Now, there's some ability for us to move nurses from other places, but it doesn't mean we need to stop caring for patients who need a different level of care. We're going to have to try to do it all.
And Carmela, what happens when the beds do fill up?
So it's really important that we think about this as more than just beds. This really isn't an issue of mattresses and pillows. Our limiting factor is staff. And so we can take a typical bed in a medical or surgical ward and convert it to an ICU bed with the technology and specific equipment. But at the end of the day, what we need is the correctly, appropriately trained nurse, doctor, therapist, whatever that need is, at the bedside. That is our limiting factor. That is what is so different in this surge than what we saw in the summer. There simply is no cavalry coming of additional nurses to California.
All right, so the cavalry that we're looking for is in the vaccine, then, it sounds like. Bob, California should be getting the first doses of the vaccine in the next week. You may be among the first to be inoculated. Can you tell us about the plan for distribution and if you agree with it?
Well, first of all, I can't overstate how exciting this is and how wonderful this is. It was just a month ago that we learned that the Pfizer vaccine was as effective as it was. And people don't get this, but 2 days before that, it was not a slam dunk. We weren't sure that we would find a vaccine that worked. We don't have one for HIV. We don't have one for hepatitis C. And so it's really thrilling that the vaccines have worked and been demonstrated to be safe and effective this quickly. The distribution plan says that it will go to frontline healthcare workers first, which is why I will be not at the very front of the line, but we'll get it probably within the next week or two, and people in nursing homes. That seems appropriate to me. The groups after that are going to be essential workers. Those are folks that have to go out of the house to work. It might be teachers, firefighters, policemen and women, people who work in grocery stores. And then once it goes beyond that, then you start getting to people who are over 65 and people with other conditions that put them at higher risk. When you add up all of those groups across the United States, you get to 144 million people. So almost about a third of the population of the country, probably true of California too, that we need to cover before we start making it generally available to everyone. That's probably going to take about 3 months before we have enough vaccine to get through those high priority groups.
Carmela, is the California Hospital Association happy with the distribution plan?
We have been part of the planning along with the state in terms of the distribution of this vaccine. It is not without its logistical challenges, especially this first vaccine candidate, the Pfizer vaccine, which has some very special conditions in terms of storage and handling. It requires those ultra cold storage capabilities, which means initially in California, there will be 30 places where the vaccine will be distributed. 18 of those are hospitals. As new vaccines come on and those that may have less special conditions for storage, we hope to be able to distribute it even more quickly.
When do children come into play here? Are they going to be vaccinated at some point? Dr. Bob, I'll ask you first.
Sure. The hope is that they will be. The vaccine was not tested in anyone under about 16. And so it would be premature to make the vaccine available to kids until we tested in them. The tests are beginning, and I suspect that they will be proven to be safe and effective. But the kids probably won't come online until probably the spring. Now, it turns out that we know that the kids have a lower rate of getting very sick. And actually, the younger kids have a lower rate of spreading the infection. So even if we had the vaccine available for kids now, they probably wouldn't be in the first group. And if you want to keep the schools open, as we all do, the most important things are getting the rate of virus in the community down as low as possible and protecting the adults in the schools. So we may find ourselves in the spring where if all of the adults in the schools are vaccinated and the rate of virus in the community goes way, way down, that the schools are plenty safe even though the kids have not yet been vaccinated.
Bob, what are your concerns about access to this vaccine in terms of equity? How are money and power going to influence this situation? I understand that there have already been donors and supporters of UCSF who have called asking to get access to this vaccine.
Yeah, we're getting a lot of calls from everyone, and that'll last for a month or two while there's a severe shortage, and then I think it will lighten up. This is an ethical test for our entire system because the priority groups really are the people that have the highest risk of dying from COVID or the highest risk of getting COVID. And it's going to be very important that we stick with that. I'm not too worried about the first groups, about healthcare workers and about people in nursing homes. It's pretty clear who's in those groups. It gets a little dicier once you start getting down to the third group, which will be people at higher risk, either over 65 or people who are essential workers or people who have pre-existing conditions. And most of those folks will probably be getting their vaccine from their local Walgreens or CVS. And whether the clerk at Walgreens or the pharmacist is going to check to see your ID card and see that you actually do work as a teacher, or how they're going to figure out that you do have a pre-existing condition, that you have diabetes or you have heart disease, I think that's pretty tricky, and I don't think we've gotten to that yet. There was a report today in the press that said it may just be the honor system, and if there's enough vaccine around, that's fine. If it's not, there's probably going to be some shenanigans, and we're going to have to watch it very carefully.
Carmela, would you like to add to that?
Would just like to say that there is some concern on hospitals' part in terms of distributing the vaccine. How do you know the person in front of you is the person who is supposed to be in that line, in that place in the queue? So I think we will, as a state, watch that very carefully. I think the governor has said that we want to make certain these early doses in particular go to the right people, those at greatest risk. And we'll just have to really work together to make certain we've got the best information as we're administering those doses.
Bob, when do you project that we're going to get back to a state of normalcy, herd immunity, as we often talk about it?
Yeah, it's a little hard to tell because we don't know if there will be additional vaccines that enter the pipeline. But the best guess is that there will be enough vaccine to vaccinate 70% of the population sometime around this summer. And that's the magic number. If we can get to 70% of the population being vaccinated, because of the characteristics of the virus, it just will not be able to find enough vulnerable noses and mouths in order to infect more people, and it begins to die out in a community. So the two things that will determine that 70% are the vaccine supply and then whether people are willing to take it. Now we're talking about how we triage in the face of scarcity. By the late spring, we'll be talking about how do we get people to take it if they're still hesitant. I'm hoping that they will. I'm hoping that by then they'll see that the vaccine, I mean, it's clear now the vaccine is remarkably effective. The evidence is that it's quite safe, although some people may want to wait a little bit. But I think the spring will have had tens of millions of people vaccinated, and I'm hoping that it won't be that hard for us to reach that 70% threshold. After that, then we should be able to get back to something resembling normal.
I know you've said you will be right there and happy to take it. Carmela, what about you? Are you feeling comfortable in taking the vaccine?
Yes, I am at this point. I will be far down that list, I'm certain. But if there's a critically important addition to what Dr. Wachter has just said, and that is, how do we make certain that with this initial delivery of some doses of vaccines, we don't, as Californians, let down our guard on masking and social distancing. While it is a relief to have some of that vaccine starting to flow, it is not until we get to that point in the summer or maybe even fall of next year, we've got to maintain masking, social distancing. If we continue to surge as this vaccine is delivered, we will again continue to face overwhelming numbers of illness.
Carmela Coyle, the CEO and president of the California Hospital Association, Dr. Robert Wachter, chair of medicine at UCSF. Thank you both for your time and your insight today.
Thank you.
Next, essential workers face many challenges during the pandemic, not the least of which is childcare. This week, many parents welcome the news that playgrounds can reopen throughout the state, providing a much-needed outlet for children and their caregivers to stay healthy and sane. But some parents are struggling to fill a broader need: reliable childcare. California's Department of Social Services estimates that nearly 2,500 family childcare facilities have closed permanently in the state since the pandemic began. Advocates are calling for more government support for childcare providers and the system as a whole. A new documentary film follows the painful childcare choices parents often face in order to make a living. Let's take a look.
I've been doing this for 22 years. I have all different types of families in my daycare. I have some that comes in at 6 o'clock in the morning that works to 8:30 at night. I have some that comes from 3:30 to 12:30 at night. I have some that comes in overnight. I see a lot of parents come in and break down. They don't want to do this. but they need to work and take care of their family.
See you later. All right, baby, have a good day. Be careful.
This is the way the world is set up at this point.
I'm joined now by the filmmaker of this heartbreaking documentary, Loira Limbal from San Juan, Puerto Rico, as well as Amy Latterman, Chief Advancement Officer at the Children's Council of San Francisco. Thank you both for joining me today by Skype. Loira, let me start with you. You live in New York. This documentary was filmed in New York, but you're in Puerto Rico now, and this is to get help caring for your own children. Tell us about your personal situation.
Yep, I'm a single mother of 2 children, 7 and a 9-year-old, and 9 months into this pandemic, just completely worn down by the impossibility of what we're asking mothers and working mothers to do. I am a New Yorker. I'm from the Bronx, and my community is a community that has been disproportionately impacted by this pandemic. My own mother had COVID, right? And so just exhausted on every level, and not being able to patch together support at home, and knowing that I had family and friends here in Puerto Rico who were in a position to help me. And I figured, we're all fending for ourselves sort of, at this moment. And I had to do the same. Otherwise, we were going to fall apart as a family.
Yeah. And, this is a personal struggle. I feel this struggle. Amy, you have children. I know that we feel this. Amy, can you tell us about how we got here in America? What was the history that brought us to this point where the system seems to be so broken and so hard for women to make it work?
Yeah, I mean, the system is developed over time as a patchwork, and we started off by assuming that caregiving was women's work. And we haven't moved beyond that as a society. In so many ways it plays out, and the pandemic has laid bare the fact that women really bear the brunt of caregiving for their children, and it's so visible to all of us now. We're on these virtual meetings. We see children in the background. We can see it, how a third of our workforce has young children, relies on childcare to get to work and to run our economy. And essential workers are really, also struggling really with this in order to access childcare. Their regular childcare provider might have closed during the pandemic or temporarily closed, or having to change all the regulations that they're following. The whole system is stressed. The whole childcare infrastructure is really in crisis. It was in crisis before we even got into the pandemic. And, the people really carrying the load are the working parents like Laura, and the child care providers, many of them working out of their homes, putting their own lives at risk, their own families' lives at risk, in order to hold up other families so that they can keep earning a living.
And Loida, what did you learn about this crisis as you were going about the process of researching and filming this documentary?
Yes, well, so many things. First, that we are having a conversation about childcare. But really, it's a much it's a structural, larger issue around our economy, period. Because you take the parents that use Nunu and Patrick's daycare, this is the daycare in the film, they are working sometimes multiple jobs because an employer refuses to give them full-time hours so that they don't have to pay for health insurance and other benefits. Or even in professions like nursing and other professions that are sort of well-paid and respected, visible professions, there are needs that no one sort of accounts for. So if you're a nurse and you have multiple children and you have to work the night shift, who cares for your children? Sometimes we have this conversation in terms of daycare, but care is happening around the clock, right? And so it almost indicates how outdated the conversations that we have about the reality of our economy, who does the work that is truly essential, and what do they actually need? We don't really have that conversation in the United States. And so, there's just sort of harm and violence happening, to so many different communities on a lot of different levels.
Amy, can you put some specifics on this in terms of the state of California and how significant this child care crisis is?
Yeah, I mean, we already had a shortage of childcare coming into the pandemic. It's costly. It costs as much as a UC education annually to have your child in childcare in California. And then if you're working non-traditional hours, you're really going to struggle to find care 30% of the families that we serve who are very low income, so they qualify for a child care subsidy, a public subsidy, 30% of those are looking for non-traditional hours, whether it be overnight or the early morning shift or late shift. And so this really needs to be a public good. We need to treat the care that we give our children when they're 0 to 5. We need to treat that as a public good, like we do our K-12 education.
And Loida, would that also be your recommendation? It sounds like we're talking about government intervention, about government support for childcare. Is that where you see the policy changes needing to happen?
Yeah, absolutely. Absolutely. A lot of the conversation about childcare and childcare policy ends up really being a conversation about early childhood. And that starts at pre-K when they're 4 or 5. But what are you supposed to do with your children between 0 and 4 or 0 and 5? And again, this work is sort of shooed off, and it's work that's done in private spheres that is done by Black women, by immigrant women, right, by lower income folks. And it's taken for granted, and it's not respected, and it's not resourced appropriately. So I think that's a huge part of it. And I would also add that parents and caregivers, the providers, are truly the experts around this issue and what working families need, because they have in fact been providing the social safety net that the government refuses to provide to working people in the US. So as the experts, they need to be at the table. They are the ones that are in the best position to create solutions that work for everyone. So I think it's also a matter of us expanding our imaginations around who leaders are and what leadership looks like.
Let's talk about the leadership here in California. Very clearly the leader, Governor Newsom, he's often spoken about the importance of investment in the first 5 years of children's lives. But the state is also going through a big budget crisis due to the pandemic. Amy, how have child care providers and how have early childhood education fared in terms of the budget, in terms of funding at this time?
So Governor Newsom came out right away with his first budget with a really strong investment in the first 5 years of life for children, whether that's home visiting during those early days, prenatal support, preschool, universal preschool intent, and making sure all kids get to kindergarten. They've come forward with relief dollars during the pandemic, but there's so much further to go. We're really far from the kind of universal support, universal care we need during those years. And we really, every county in California has a waiting list of really low-income families that do qualify for government subsidies. So we're not even meeting the very low threshold that we have already set for who could get free or reduced cost childcare. We have a long ways to go.
Loida, what actions are you hoping to spur through the release of this documentary?
Yes, I think on one level, as I mentioned, this sort of imagination piece. One is just sort of making visible this universe that has been invisibilized and sort of get us beyond statistics and data and actually sit and behold these people and really take in how amazing and not to overuse the word, but how literally essential what they do is. So that's one piece of it for me. And I think part of wanting to make this work and the value of this work legible to more people is about us as a society understanding that care is something that we all need, right? And in this COVID-19 moment, I think we do have an opportunity to sort of move the needle on our understanding about this, right? We have deemed this women's work in air quotes, and so then we have devalued it, right? But we need to put it back at the center. Care is something that we all need. It is something that we are all capable of giving, and it is a collective responsibility. And then once people are in that place of centering care, my hope is that they begin to care, right, about our caregivers and connect with the organizations and the campaigns and the folks doing this work in their communities.
Amy, how do you measure the value of this care and the investment, particularly in early childhood care?
I mean, if we're going to look at it from an economic standpoint, we have research that shows us now from our Nobel economist, James Heckman, that the investment in early childhood years pays off manyfold. for every dollar that we commit to this quality care and education for children when they're under 6 years old, we see a $13 return over the course of their lifetime as a society in terms of other things we don't have to pay for. In addition, and that number goes up if you're talking about certain subsections of the population like our Black boys, you'll see an $18 return in some populations. It's an incredible response and more effective than any poverty alleviation strategy that we have. In addition, when you think about brain development, we know that if you can provide children with nurture and care when they're little in these 0 to 5 years, that brain development really flourishes. They're set up for success in school, they're set up for success in life. So we really need to be putting that investment into that time so that children can succeed over their lifetime, and so our society really sees those benefits.
Amy Latterman with the Children's Council of San Francisco and Laura Limbal, the filmmaker of Through the Night. Thank you both for joining us.
Thank you.
The film premieres online tonight and will stream until December 24th. For more information on the documentary and how to watch, go to throughthenightfilm.com/events. And now for this week's look at something beautiful. We travel to the north end of the Golden Gate Bridge and visit Cavallo Point, named in 1775 for the wild horses that once roamed the region. And you can find more of our news coverage at kqed.org/kqed-newsroom. I'm Priya David Clemens. You can reach me on Twitter, Facebook, and Instagram at Priya D. Clemens. From all of us here at KQED Newsroom, thank you for joining us. Good night.